everybody, and welcome to the Anxious Resistance, and I'm going to be talking about benzodiazepines today. So benzodiazepines are a class of medication that's used for two things primarily. It's seizure prevention, or stopping seizures once they've started, and they're used for anxiety. Also used sometimes for withdrawal symptoms. So when you're coming off of alcohol or coming off some other addictive substance, sometimes these are used to help ease that transition. Okay, so what medications are benzos? And I bet you've heard of a lot of these. One that's very common is Ativan, also known as Lorazepam by its generic name. Another one is Xanax, which is known as Alprazolam. Another one that has kind of a longer life, so stays in your system longer, is known as Klonopin or Clonazepam. And then another one you've probably heard of, Valium, is Diazepam, is the generic name. One other very common one, it's known as Restoril. The generic name is known as Temazepam. What's the deal with benzos? So they've been around for a long time. They are very effective at preventing seizures, and they're also quite effective at taking away anxiety. They work through the GABA transmission in the brain and throughout the nerves. Why I'm talking about them today is because they are often overused, especially in a clinical setting. These medications are quite addictive. Over time, you have to have more and more to get the same effect. They're very difficult to get off of, and a lot of people end up going into rehab and other things because they just can't get off of these medications. So they really are not a long-term solution for those with anxiety disorders. In fact, they may do more harm in the long term than they do good. Benzos are linked to different long-term side effects such as memory loss, fusion, and difficulty thinking clearly, difficulty sleeping, disturbing dreams, personality change, and changes in emotional responses. They can actually increase your anxiety over time, and they are also linked to irritability, paranoia, and aggression. So these medications, they've been used a lot for a long time because they've been around a long time, and for a while, it's honestly all we had for anxiety disorders. And so doctors used to prescribe them like candy, and they were everywhere. I'm not here to just present problems to you. I want to show you what some of the solutions are. Now, there's a lot of options that you can go to before you need to go to benzodiazepines for anxiety disorders. One, which I talk about in another video, I'll link here, is hydroxyzine. Hydroxyzine is an antihistamine, and it's very effective for treating anxiety symptoms. It also is non-addictive and is something that you can use in the long term. Not to mention it will help with your allergies. And another option that you can try before going to benzos is gabapentin. Gabapentin has shown in studies over and over again that it can treat anxiety symptoms. Now, I was on gabapentin for a while, and it didn't help me. I didn't notice any effects from it, but there are many out there who have great results from gabapentin, so it's something that you can try. And another one, Lyrica, works very much the same as gabapentin, has also been shown in studies to help with anxiety. This one has some slight potential for addiction. It's less so than the benzodiazepines, so it's not quite as addictive. So it's something that you may want to go to before the benzos, but there are also other options. Another whole class of medications that you could try are the beta blockers, and another class besides that are just, all the antidepressants. There's 3 or 4 different classes of antidepressants that are effective for anxiety, and you can try those as well. So there are lots of options here. I just want people to know and understand that benzodiazepines are not a good solution in the long term for anxiety disorders. They just really lead to more problems, they lead to addiction, and they lead to all those really bad long-term side effects that I talk about. So talk with your doctor about some of these other options to go to before you go to benzodiazepines. Sometimes doctors are quick to go to those benzos, so you tell them, hey, I want to try something that's non-addictive and is a long-term solution for me before going to those benzos. Everybody, thank you so much for watching. I hope you enjoyed this video. If you like this content, please give us a like down below and subscribe to our channel if you want to hear more. And thank you so much for watching. This is The Anxious Resistance.